I'm self-employed as a freelance translator and interpreter, and I do not obviously have insurance through my employer since I'm self-employed. And I have a pre-existing condition. I'm diabetic, and the cheapest quote I can get on private insurance is between $700 and $1,000 a month, with something like a $5,000 or $10,000 deductible and 50% co-pays on everything. Basically, I'd be flushing $700 a month in the toilet because it would provide coverage that would enable me to afford health care. And of course, paying out of pocket is really unquestionable. I haven't even seen a doctor in 6 years now. One of their blood tests I'm supposed to do every 6 months. So I want to do those, and also lately I've been having migraine headaches. So I'd like to see if I could talk to somebody about that.
Day-to-day basis.
I've been lucky. When I was first diagnosed, I was teaching in public schools, and at that time I did have insurance for about the first year. And the doctor got me on a low-carb diet, and since then I've actually been able to control my blood sugar with exercise and my diet, and I'm relatively healthy. But I've been told that'll only work for so long, and eventually I'm going to require medication or further care. Hopefully by then we'll have had some form of reform in our health system, because currently if I required regular care or medications, it would break us. I'm a single father. I have custody of my daughter. And since the recession hit in summer of 2008, my income's been cut roughly in half. So we're not well off, and we'd be in real trouble. As things currently stand, if I required further attention, I do not believe that I would be able to get that without incurring huge debts that I would be unable to pay. Well, obviously it causes a lot of anxiety, a lot of stress, and also, having to provide health care for my daughter. Now, the state of Connecticut has the Huskey program. They've turned us down 3 times in the last year that I've applied because being self-employed or something, I don't meet some of their requirements, or I'm unable to provide them the paperwork they need. So, whether I required health care for my diabetes or my daughter required some kind of care, when I think about the expenses that we can incur, because it really causes a lot of stress, a lot of anxiety. I pay a lot of taxes being self-employed. I pay 20 to 25% of my income in taxes. And my feeling is, if I'm paying that much in taxes, I should have a say where my tax money goes. And I believe it should go to providing health care for all these people. We've had the whole swine flu scare this year and everything. And I thought, what would I do if my daughter caught swine flu at school and required hospitalization? It would be ruined.